Um, Thank you all for being here today. We're going to talk about seasonal allergies and how they affect your ears, nose, and throat, also known as ENT. This is something that impacts many of us, especially at work. We do have a few polling questions to make it more interactive, like Heather said. So, if you can, go ahead and jump in. We'll start off. The first one is a polling question. How many of you are deal with allergies every year? So, majority, oh, I think there's someone in the chat. Okay, perfect. Yeah, majority of people have some sort of allergies throughout the year. It's very common. Um, Allergies happen when your immune system overreacts to things that are normally harmless, like pollen, dust, mold, or pet dander. Your body treats these like a threat, which causes symptoms. So, polling question number two, what do you think triggers your allergies the most? Congestion, headache, fatigue, itchy eyes? Um, Anybody deal with these things, these common things? So, for me personally, I get really bad headaches and it's allergies. Okay, so I see in the chat, yeah, fatigue, itchy eyes, congestion, fatigue, itchy eyes. Yeah, definitely. Both of these answers can be true, but depending on individuals, it's not just you. Texas really does have one of the toughest allergy environments. So does allergies get worse with age? Some develop new allergies as adults. Others feel symptoms worsen due to repeated exposure over time, changes in immune response. And like I was saying, yeah, especially here in Texas, we have high pollen counts, cedar, oak, ragweed, long allergy seasons, and then all the weather shifts. Like currently, right now, it's been raining for so many days on end. So, all of those things can trigger your allergies and make things a little bit worse for you. So, the most common symptoms include sneezing, runny or stuffy nose, itchy or watery eyes, throat irritation, headaches, and fatigue. These may seem minor, but they can really affect your daily life. Which of these symptoms bother you guys the most? The sneezing, runny nose, itchy, watery eyes, throat irritation, postnasal drip, headaches, fatigue, poor sleep? All of them, yeah. I honestly, for me, like I said, it's really just the headaches. All of them. Yeah, all of them. And then the weather doesn't help, right? So, why allergies matter? Affect focus, sleep, and work performance, can reduce quality of life, and often underestimated. So, allergies don't make you uncomfortable. They affect your sleep, your focus, and performance at work. Many people feel tired or foggy and don't realize allergies are the cause. So, a lot of times people are, complaining of signs and symptoms of being having like a common cold, and it's actually from your allergies. Have you ever felt exhausted during allergy season? Another common question people have is about hives. Hives are those raised, itchy welts on the skin that can appear suddenly. Many people think hives always mean an allergy, and sometimes they do, but not always. Hives can be caused by things like food, allergies, medications, or environmental triggers, but they can also happen from infections, stress, or even unknown reasons. So while hives can be allergy related, they're not always caused by allergies. And so then that will bring us to the next thing. How do we know and when to seek care for hives? If you experience hives, it's important to know when to seek care. You should see your primary care provider if the hives keep coming back, last more than a few days, or affecting your sleep or daily life. However, if you notice swelling of your lips, face, or throat, or if you're having trouble breathing or feeling dizzy, this could be a serious allergic reaction and you should seek help right away. Allergies can also cause inflammation in your nose, which leads to congestion and blocks sinus drainage. When mucus gets trapped, bacteria can grow, and this is what we call a sinus infection. Another explanation, allergies block the sinuses, and when things can't drain, infections can develop. This can cause pressure, headaches, and even infections. Sinus pressure, coming from your forehead, your cheeks, and behind the eyes. Headaches are caused by congestion. Has anyone ever experienced one of those sinus pressure headaches or just sinus pressure in general? Yes, yeah. Those are definitely hard to deal with, especially when they are behind the eye for me. It's kind of hard to get them to go away. So these are called sinus headaches, and it's one of the most common allergy symptoms. Allergies can affect your ears by causing pressure or clogged fillings. They can also irritate your throat, causing coughing, hoarseness, or constant throat clearing. Does anyone feel like their ears pop or feel full? That's also from your allergies when you're just kind of like muffled up and clogged up. Yes, right. Yeah. And that happens. It's like almost like being on an airplane sometimes where you just can't get your ears to pop. So, polling question number three, where do your symptoms worsen? For you, is it at work, home, outdoors? Do you see like maybe one place is a little bit harder for you to manage than another? Working outdoors, yeah. Same for us. Luckily for me, my office space has a humidifier they put in there, so it's made it a little bit easier for us, home and outdoors. Okay, yeah. And it's good to kind of recognize those triggers, and so, it can help you avoid those areas if you can. I know it's kind of hard, especially whenever it's like we have to go to work, home, and depending on outdoors, maybe if you can go around the certain things that may be the triggers. So, common triggers at work include dust, mold, cleaning chemicals, and pollen that gets inside buildings. Think about your own environment. What might be triggering your symptoms? There are simple things that you can do to help, like rinsing your nose with saline, using air filters, steam, warm compressed to the face, cleaning surfaces, and staying hydrated, and over-the-counter medications, antihistamines, nasal sprays. While we cannot completely cure allergies quickly, you can at least control them. So some prevention strategies would be avoid triggers like pollen, dust, molds. I know that that's, kind of easier said than done because those are not things that you can always just see. Most of the time you can't see. And then keep indoor air clean. So filters, cleaning, shower after outdoor exposure, especially if you're someone that does have a lot of outdoor triggers. Keep windows closed during high pollen seasons. And then control your symptoms. So start medication early before symptoms worsen if you think that there has been an exposure. Use nasal sprays regularly during the season. Consider allergy shots for long-term control if, I just recently did an allergy test and I fortunately wasn't allergic to many things, but if I were, my doctor was going to put me on the injections. And so, which one of these do you already do? Or is there anyone that kind of is already taking control and being proactive? Maybe you have a humidifier or keeping the indoor air clean with the filters. So, the bottom line is controlling early and fewer symptoms later. Steam, yeah, definitely. And then someone said, "Oh, at home, the cat." Oh, yeah, d definitely animals can trigger our allergies for sure. Air filter at desk. Oh, that's perfect. That's a really good one. So some people use vitamins, herbs, or just like we talked about, the steam inhalation. These can help support your body, but they are not cures. So we just talked about that. I asked, has anyone tried? And you guys said yes. So we had a question come in and it said Texas Clear home allergy relief. So the recommendation would be, oh, sorry guys, it's a question that's come in here? I'm trying to understand. So it says, I'm familiar with homeopathic products like Texas Clear. Some people choose to use them and report symptom relief. So important notes from this, limited scientific evidence on this, not regulated. The same as medications may work differently for different people. So the recommendation would be you can be used as supplements, but not a replacement. Always consult with your provider, especially for children, if taking other medication, if symptoms are severe. Um, what we want to take away here is some people try these products, but we recommend using them alongside, not instead of. And then over-the-counter medications like antihistamines and nasal sprays can help control symptoms. If symptoms are more severe, it's always recommended that you follow up with your provider and then they can recommend stronger treatments. Has anyone tried any of these, I'm sure, popular medications, Benadryl, Allergies, Zyrtec, Allegra, Claritin? Um, and I know for, most people, you have one that works better than the next. I actually just had someone tell me that they have been using children's Benadryl, that their PCP recommended that, and it's been like the best thing. And I'm talking about an adult. So that was interesting to hear. Eye drops and allergy shots. Yeah, that's definitely good. And it's nice that you get the allergy shot. So that's like one of the best things you can do. Same, yeah. And how often are you guys doing the allergy shots? Every other week. Okay. Yeah, so that's pretty good, especially if, you're one of the people that suffer pretty bad from allergies. For about 2 years, I used to go every other week for about 2 years. Okay. And I assume the allergies have just gotten kind of better, and that's why you haven't gone as often, or? Alrighty, guys. Good. I'm glad to hear it's not as severe. So, medication that can help treat hives. Benadryl is commonly used and it can help. Other over-the-counters, like we spoke about, Zyrtec, Claritin, Allegra. Benadryl works fast but causes drowsiness. So that would be the biggest thing there, to make sure if we're taking Benadryl that you realize that it is going to make you drowsy. And so avoid driving if you're taking Benadryl, and then follow the instructions carefully. You want to seek medical attention if any of these medications have your lips swelling, face, throat, breathing difficulties. That's like you need to go to the ER. That's emergency care. For mild hives, over-the-counter medication can help, but severe reactions are always going to be treated as an emergency. So you should see your doctor if your symptoms last a long time, affect your sleep, or interfere with your daily life. Have you ever needed to see a provider for allergies? Well, I'm sure some of you have, because that's how we get the the allergy injections. So it's just kind of knowing your triggers and getting familiar with your body, and then to even maybe making a log so you can let them know when you think that your allergies are being triggered, and then if you haven't already, getting one of those allergy tests that can specifically tell you what you're allergic to. An ENT specialist can help if you have chronic sinus problems, ear pressure, loss of smell, or voice issues. So that's kind of when you decide to go see a specialist. We want to seek immediate help if you have trouble breathing, swelling of your face, throat, or feel faint. These could be signs of severe allergic reaction. So please do not wait if any of these symptoms do come up, and hopefully you're not alone. So, myths about allergies. Not always mild, not only seasonal, medication control but don't cure. Honey is not a proven cure. Allergies are not always mild, they are not only seasonal, and medication help control symptoms but don't cure them. So, our key takeaways today would be allergies are common but manageable. Use prevention and treatment strategies. Seek care when needed. Allergies, sinus infections, yes. Allergies, headaches, yes. Can you prevent allergies? Oh, sorry. Can you prevent allergies? You can control them, not cure them, but you can get ahead of them. So there is some prevention there. Texas pollen, very, very, very high. Homeopath options use with caution, hive treatments, over-the-counter medications, and then please know your red flags and when it is considered to be a medical emergency. Do we have any questions?
If there are any questions, you can place them in the chat or you can take yourself off of mute to ask.
Well, thank you all for joining us. If you do think of anything later, you can always give us a holler and we will be happy to answer the questions. Thank you for being here and your time, and have a wonderful rest of your day.
Thank you.
Thank
Goodbye.
you.